Hi, I'm Alex.
And I'm Donna, and we are part of the urology team at Great Ormond Street Children's Hospital.
Today we're going to demonstrate how to insert a urethral catheter. We'll show you how to do this step by step.
This video will demonstrate the insertion and cares of a urethral catheter in a female child. It is intended to support hands-on training, not replace it. Start by preparing the patient. Step 1. Gather the equipment: latex-free sterile gloves, apron. A silver trolley is preferred as a workspace. You will also need a sterile dressing pack, a catheter drainage bag, a sachet of saline, sterile lubricant such as Optilube, a 10ml IV syringe, sterile water, latex-free adhesive tape, for example Mefix, and an absorbent pad such as an Incopad. Step 2. Choose a catheter. By using the smallest catheter that will work effectively to drain urine. Use a catheterisation guideline to size according to age and weight. Step 3. Lay the child or young person in a comfortable position with their head on a pillow. Place an absorbent pad under the buttocks. Females should be supine with their knees bent and flexed outwards. Step 4. The abdomen and lower legs may be covered with a sheet. A parent or carer should remain by the child or young person's head. Step 5. Put on an apron and perform hand hygiene. Step 6. Open the dressing pack and prepare sterile field, adding lubricating agent and catheter. If applicable, remove stylet from catheter. Open 0.9% sodium chloride and pour into gallipot within sterile field. Apply alcohol-based gel to hands and put on sterile gloves. Step 7. If using a Foley catheter, open the packaging of the 10ml syringe and add to the sterile field. Step 8. Tear a hole in the centre of the sterile sheet and place over the genitalia. Step 9. Using a non-dominant hand, hold the labia open with sterile gauze. Using gauze soaked in 0.9% sodium chloride, clean the vulva using a downward motion. Clean the outer labia, then the inner labia and the vulval groove, using a new piece of gauze for each area. Step 10. Lubricate the tip of the catheter with the sterile gel. Step 11. Ensure that the child or young person is ready for the catheter insertion. Gently insert the catheter tip into the urethral meatus. Insert the catheter using a smooth, steady, horizontal motion. Resistance will be felt upon reaching the bladder neck. Encourage the child or young person to take deep breaths. Step 12. Continue to insert the catheter until urine drains freely through the catheter. If using a Foley catheter, insert to the hub before inflating the balloon. Step 13. Insert a syringe of sterile water into the one-way valve. The amount of water will be dependent upon the size of the catheter. Step 14. Remove syringe. Pull back the catheter gently to ensure it is sitting comfortably. Step 15. Attach a sterile drainage bag. Place the bag below the level of the bladder. Step 16. Secure the catheter to the abdomen or groin using adhesive strapping or a Statlock device. Do not tape to the child's leg. Step 17. Dispose of the equipment according to the truss waste policy. Perform hand hygiene. Step 18. Following catheterisation, the following must be recorded on Epic: date and time of catheterisation, batch number, reasons for catheterisation, type of catheter including length and size, volume of sterile water injected into the balloon, any problems encountered during the procedure, review date, and date to change the catheter.